Is the medicine working against me? I took the injection last week and I felt something strange. I woke up in the middle of the night at 2 a.m. with nausea, vomiting, and diarrhea. It was so bad. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Many people believe weight loss medications simply reduce appetite. That is not accurate. These GLP-1 medications change how the stomach empties and how the brain receives fullness signals. Today, I am explaining what GLP-1 medications actually do in the body and why understanding this matters more than you could ever think. So let's start with the story of Karim. Karim is 37 years old. He comes to see me for his usual 1-month follow-up and tells me that I took the injection last week and I felt something strange. And I asked him, what did you feel? He said, I went out with my friends and one of my friends had a birthday party and I ate there. I didn't even eat that much. And then I woke up in the middle of the night at 2 a.m. with nausea, vomiting, and diarrhea. It was so bad. And I kept vomiting and vomiting. And this never happened before. Is the medicine working against me? And he chuckled. I chuckled as well, but I proceeded then to break down the science of GLP-1s in a way that Karim would understand. So let's break it down in a way that both of us can understand. So what are GLP-1s and how do they work in the body? So these medications are called glucagon-like peptides, agonists, right? And so the way they work is they work first in the brain, reducing appetite signals. They make you not feel hungry, right? And this is why some patients say that they reduce food noise. Another way they work is in the stomach. They delay gastric emptying. What does that mean in plain old-fashioned English? They just slow down the stomach so that if you take 2-3 bites of pizza, you feel full right away because there is no more room in the stomach. The food that was there from lunch is still there, and the food now you're eating for dinner has nowhere else to go. And that is how the medications work. But think about this. If it slows gastric emptying and keeps food sitting in the stomach for longer periods, what happens if you keep eating? If you keep eating and the stomach distends and takes in more food, that food has trouble going forward. What happens? It goes backwards. And that's how you wind with vomiting, nausea, and what drives patients nuts all the time. Why am I feeling sick all the time? And I keep telling patients, this is a problem. You are not working with the medicine. And again, this is compounded by another thing. A lot of patients go out. For instance, Karim told me he went out and he had multiple drinks for the birthday of his friend. And what happens when you drink? It numbs your senses. It makes you feel hungry if you drink a lot of alcohol. Now you drink alcohol, now you can eat a lot of food. You eat a lot of food, your stomach takes all of it. But the GLP-1 is still in your system. And so when you go to bed feeling fine, what happens? At 2 a.m., the alcohol clears, nausea hits you, you have to vomit, and you find yourself in Karim's situation. Okay? So this is the problem. But it's not an unavoidable problem. It's really an adaptation problem. So what does this mean for your daily life if you are taking a GLP-1? It means that number one, you have to make sure you are working with the medication. This is where your doctor has to step in and show you foods that help work with the medicine. This is where education matters. GLP-1s work by decreasing appetite signals and by making you feel full faster. So you want to eat foods that make you also feel full faster, right? For instance, protein. We know that protein has something called a high thermic effect. It means it takes your body a lot of energy to break down protein. That's why if you eat chicken, you eat turkey, you eat a steak, these things sit in your stomach for a long time, make you feel full longer. So you want to make sure that you decrease the amount of food you eat, and when you eat, make it routine to eat protein, right? And veggies, things that have a lot of fiber, vegetables, green leafy vegetables of all stripes. But very important, remember your hunger cues, your hunger signals. When you eat and you're full, stop eating, right? Don't try to eat with your old eating patterns, because what's going to happen is you will just stuff food in your stomach, and then next thing you know, you're puking, right? It will induce vomit, and you do not want that. So this is a point of the story where you work with your own physiology to help your weight loss goals, because understanding the way the medicine works in your body will help you shape your environment around that medication. And remember, certain foods are much more prone to causing vomiting and nausea. Studies have shown especially greasy foods can do that. And in case I didn't say it earlier, Karim did tell me that he indulged in a lot of greasy foods. But thank God he's doing better today. Listen, as we wrap up, friends, sustainable results require understanding of how these medications work. But understanding requires you to have especially a primary care physician who sits with you and explains these things to you in a way that you understand. And that is where we always focus on physician allyship, right? You have to make sure that you understand how the medicines work. Now, this, of course, leads us to the issue of people getting GLP-1 medications and other medications online and just filling forms, and then somebody ships them medicines. This has led to a lot of people having side effects that A, they did not know about, and B, there was no one to address, and C, makes the patient just give up because they feel sick. But when you have a physician ally, your primary care doctor, if he's doing this type of primary care, he will walk with you symptom by symptom, tell you how you can prevent the symptom, or if it happens, how you can treat it, but help you steady the ship so that you don't quit the weight loss journey because you had a side effect. This requires time, it requires dedication, it requires a physician ally. And that's what we do on the Daily Brief. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.